Procedure on health assessment and physical examination. Assessment of integumentary system. Assessment of eyes, head, nose, and ears. The definition of this is health assessment is the collection of data about individuals' health. Physical examination is head-to-toe review of each body system that offer clients and allows healthcare provider to make clinical judgment. Purpose. The purpose of this is to make clinical judgment or diagnosis about clients' health state condition and obtain baseline data about client functional abilities. Procedure number 1. Identify the client and explain procedure. The rationale of this is to ensure that procedure is done to patient and reduce anxiety, thus promoting cooperation. Good day, sir. Can I ask what is your name?
Paul Argoyo.
Procedure number 2. Properly position the client. Rationale, to ensure easy access to body parts to be assessed that patient is comfortable. Can I assist you po, sir? Procedure number 3. Take the patient health history, rationale, to have comparison with previous and present health condition. Procedure number 4. Conduct physical examination in physical assessment, in inspection, pulsation, percussion, and oscillation. The rationale of this is to determine abnormal finding in body system. We are going to assess the skin. The method we are going to use is inspection. Rationale, procedure number 5, skin color. The rationale of this is it depends from light to dark, deep brown. Uniformity of skin color. Rationale, uniform except the areas of lighter pigmentation like the palms, lips, and nails in dark-skinned people. Seven, skin lesion. Freckles, birthmarks, moles, abrasions, and other lesions. Procedure number 8, skin moisture. We are going to use palpation. Rationale, moisture on skin varies with environmental and other activity. Procedure number 9, skin turgor. When pinched, it goes back to previous state. Now, we are going to assess the nails. Nail texture. We are going to use method of inspection. The rationale is smooth texture. Procedure number 11, nail polish shape or nail plate shape. Rationale, concave curvature, angle between nail and nail bed. Let's check. Procedure number 12, nail bed color. Rationale, have pink and light. Patient, dark skin patient have brown or dark pigmentation. Now, we are going to assess the head. Procedure number 13, hair. We are going to check the evenness and texture and oiliness. The method we are going to use is inspection. Rationale, evenly distributed silky hair. C, thickness and thinness. The rationale is that the hair should be thick. D. Infection and infantation of lice. Rationale, it should be no infection and infantation. Procedure number 14. Now we are going to assess the skull and face. Procedure number 9. Or A. Skull size, shape, and symmetry. Now we are going inspection and pulsation. Rationale, rounded, normocephalic and symmetric with frontal, parietal, and occipital smooth contour. Skull, nodules or masses and depression. Now we are going to use palpation. Smooth, absence of nodules or masses. C. Symmetry or facial movement. Rationale, symmetrical face movement. Assessing the eye, structure and visual acuity. Inspect eyebrow hair distribution. Method use is inspection. Hair evenly distributed, skin intact is symmetrical, equal movement. B. Ability of the eyelid to blink. Rationale, lids closed symmetrically. Letter C. Lining the eyelids by reversing the lid. Rationale, shiny, smooth, details of iris is visible. D. Cornea, clarity and texture. Rationale, transparent, smooth, details of iris is visible. E. Pupil color and symmetry of face. Rationale, black in color, equal size, usually 3 to 7 mm in diameter, flat and round. F. Pupil reaction to light. Rationale, illuminated pupil constrict, direct response, and non-illuminated constrict. G. Reaction to accommodation. Rationale, pupil constrict looking at near object while dilate when far, converge when moved near to the nose. Now we are going to assess the ear. The method we are going to use is inspection and palpation. Uracles, color, and symmetry. Rationale, color, same as facial skin. Uracles and elasticity and areas of tenderness. Method we're going to use is palpation. Rationale, firm and not tender. Rena, recoil after folded. C. Hearing client respond to normal voice tone. Rationale, normal voice tones audible. 1, 2, 3, 4. Client responds to whispered voice. Rationale, able to repeat non-consecutive number. 1, 3, 2, 4, 5. Now, we are going to assess the nose. External nose shape, size, color, and discharge from the nose. The method we are going to use is inspection. Symmetric and straight, no discharge of flaring, and uniform color. Palpation, the external nose, areas of tenderness, masses, displacement of bones, and cartilage. Rationale, no tender and no lesion. Procedure number 18, assessing the mouth and oropharynx. A. Lip and vocal mucosa. The method we are going to use is inspection. Rationale, uniform pink color. B. Teeth and gums. Rationale, pink gums, white teeth, and shiny. So, C. Tongue and floor of the mouth. Rationale, pink gums, smooth, white, and shiny. C. Tongue. D. Tongue movement, moves freely and no tenderness. Can you open your tongue, mouth, sir? E. Oropharynx and tonsil color, texture using tongue depression. Rationale, pink and smooth posterior wall. Now we are going to assess the neck. A. Inspect the neck muscle. Where the rationale of this is to that muscle equal in size and head center. 20. Observe head movement. Rationale, smooth, coordinate movement without discomfort. 21. Palpate the thyroid gland for smoothness. Method of use is palpation. Rationale, lobes may not be palpated. Procedure number 22. Reposition the client. Rationale, to ensure client comfort. Procedure number 23. For evaluation, make finding of health assessment, physical examination done to client. Rationale, important data conveyed to physician, aid diagnosis to patient. And lastly, procedure number 24. Documentation. Record, document, and result of the patient finding during assessment to appropriate assess or personnel. The rationale of this is to provide accurate data and in care for the patient. So that's the end of assessing the eyes, nose, heads, and ear.